Hello everyone, and thank you for tuning into my podcast today. My name is Bridget, and today I will be discussing COVID-19 related symptoms, more directly on the loss of taste in adults following COVID-19. The takeaway from this podcast will be to help you better understand why people tend to experience loss of taste after having COVID-19. Considering this is one of the most common symptoms following COVID, people often wonder why this occurs from a sickness that is so similar to the flu. Today I want to dive deeper into what causes the loss of such sensation and how it can affect your everyday life while dealing with this symptom. So for a little overview, the scientific term for the loss of taste is pronounced ageusia, and while not every COVID-19 patient experiences the loss of taste, studies show that out of around 138,897 people, 39% report experiencing loss of taste following COVID-19. According to research on ageusia, young people have a higher risk of experiencing the side effect from COVID-19 than older people. In addition, studies have shown that there was a significantly higher percentage of females with COVID-19 who demonstrated a loss of taste at 63.2% as opposed to only 36.8% of males who displayed this loss. It is very important to note that ageusia is a temporary side effect from having COVID-19, and it typically lasts no longer than 1 to 3 weeks after experiencing other symptoms of COVID-19. The main cause of ageusia is lack of nutrition and sinus issues. When a patient has COVID, they often lose their appetite and experiencing having a stuffy or runny nose, which both can contribute to developing the loss of taste and smell. When experiencing the loss of taste, a patient won't be able to distinguish different flavors of various foods or liquids. I remember when I had COVID-19 and I drank a ginger shot and a peanut butter smoothie and I could not tell the difference. Everything just tasted bland like water. While ageusia can be annoying to deal with, it doesn't affect one's day-to-day living, unless someone is a certified taste tester or chef, I guess. However, while experiencing the loss of taste, it could lead to other side effects like fatigue or nausea that could impact your health. The best known treatment for COVID-19 and all symptoms related is getting vaccinated against it. However, in the event you do get COVID, there is no known treatment other than treating it like the flu. Hydrating your body, getting rest, and taking appropriate over-the-counter medicine like Mucinex is very important. One tip I learned was to never sleep on your back, but instead sleep on your side so that fluid doesn't settle in your lungs and make you sicker. COVID-19 is still new to medicine, and doctors are navigating their patients to survive this sickness. During the onset of ageusia, it is important to keep up with fluid intake and eat even though nothing may seem appetizing. You just have to ride it out and let your body go through the motions of fighting off COVID. If you feel that you are experiencing the loss of taste or any other COVID-related symptom, the best thing to do is to reach out to a doctor and get tested right away. Many doctors offer same-day test results and can help you develop a treatment plan for your sickness and give you tips and tricks of how to combat COVID-19. Alright guys, that wraps up today's podcast on loss of taste following COVID-19 in adults. I hope after hearing this podcast you have a better understanding of what ageusia is and the role it plays in COVID-19. Have a great rest of your week and take care.